Hello, Stephanie and I chose to do our presentation on polycystic ovarian syndrome and exercise management and the role that it has on reproductive health.
So for this presentation, we are going to start with a quick PCOS overview. Next is first line of treatment of PCOS, and then our chosen evidence-based medicine article, PCOS and exercise management. Next would be our worksheet for our topic, and last would be our references.
PCOS is characterized by an excess of androgen production, irregularities in the menstrual cycle, and cardiometabolic dysfunction in women. And when it's fully expressed, the manifestations include irregular or absent menstrual cycles, hirsutism, which is excessive hair growth because of hormone imbalancement, obesity, insulin resistance, and anovulatory infertility. So oftentimes these women are trying to get pregnant with no success. Also, when the patient presents to the clinic, they might present with lower abdominal pain, sometimes pelvic pain.
Women with polycystic ovarian syndrome have multiple abnormalities that require attention, which includes oligomenorrhea, anovulatory infertility, and metabolic risk factors such as obesity, insulin resistance, dyslipidemia, and impaired glucose tolerance. So, as clinicians, our overall goal therapy for women with PCOS, we have to think about how can we restore the ovulatory cycle for them? How can we help with inducing pregnancy for those who are seeking to get pregnant? How can we improve hyperandrogenic features such as hirsutism, acne, scalp hair loss, and how do we manage underlying metabolic abnormalities and reducing risk factors for type 2 diabetes and cardiovascular disease? So, first line of treatment of PCOS. According to the Journal of Clinical Endocrinology and Metabolism, lifestyle modifications, specifically weight loss management, diet, and exercise, have been proposed as the initial treatment strategy for most women with PCOS. So basically, maintaining a healthy body weight or weight loss helps with improving overall cholesterol levels. It reduces the risk of high blood pressure, heart disease, diabetes, maintaining ideal insulin levels and androgen levels that also restore ovulation phase in the menstrual cycle. And also by doing regular exercise and becoming active will help in regulating blood sugar levels and keeping the weight under control.
So, Stephanie and I chose this article because of the fact that PCOS is a very common condition and diagnosis that we will see in primary care, as well as if some of us choose to go on and pursue specialties such as women's health. So, what intrigued us is the fact that there's different effects for different exercise regimens in the management of PCOS. So, there's high intensity interval training, which is known as HIIT training or HIIT, and continuous aerobic exercise training, known as CAET. And the effect that this has in women's health is that in the past, exercise has been recommended for women with PCOS. However, what's unclear is what is the most effective form of exercise. So, as future healthcare providers and practitioners, we need to have a knowledge base regarding the most effective form of exercise in order to better educate our patients and to give them the best quality of life.
So, this is the evidence based medicine article that Nina and I chose. It's called Exercise Training and Reproductive Outcomes in Women with Polycystic Ovary Syndrome, a pilot randomized controlled trial.
The abstract of this article discusses that exercise is recommended for PCOS, and previous research has been done regarding the effects of exercise. However, what has not been made clear from previous research and findings from that research is what is the most effective exercise regimen. So, like cardio, strength training, etc. So this article in specific compares the effects of high intensity interval training, known as HIIT training, and continuous aerobic exercise training, CAET. And it also has a no exercise control group. And then the research analyzes the effects on reproductive and anthropometric findings, such as body mass index, BMI, and waist circumference, and also cardiometabolic outcomes in PCOS. So, for example, lipid panel, the LDL, HDL levels of these women. The design of the study is it's a pilot randomized controlled trial, and the participants are previously inactive women from the age ranges of 18 to 40 years of age with PCOS. So these are inactive women, meaning that they had no previous exercise regimen established on a day to day or weekly basis, and they have a previous diagnosis of PCOS.
So, diving deeper into the article, it talks about PCOS and how it affects 15% of reproductive age women. Signs and symptoms include irregular menses, androgen excess, and polycystic ovaries, and how it's associated with infertility, reduced quality of life, and cardiometabolic abnormalities. Previous research has explored the role of aerobic exercise, including CAET and HIIT, and how previous research suggests that aerobic exercise improves cardiometabolic and reproductive outcomes in women with PCOS who are overweight and obese. However, type and frequency of exercise was never specified, so it never really talked about which exercise was best for PCOS. So in this study, the design they conducted a 6 month single center RCT in Calgary, Canada, between December 2017 and September 2019. The trial had a parallel group design with three phases. Um, First phase was a 3 month run in phase. The second phase was a 6 month intervention after randomization of to hit CAET or a no exercise control group. And the third phase was a 6 month post intervention follow up. Of course, all participants were provided written informed consent, and trial outcomes were assessed objectively by our health professionals and lab techs, blinded to participant group assignment. So, participants in the study were untrained women aged between 18 to 40 years old with PCOS, defined by Rotterdam criteria, and were recruited by advertisements, the media, physician referrals, and by word of mouth. Exclusion criteria included medical conditions, restricting exercise, participation in 40 minutes of exercise training weekly, and medications potentially um, affecting ovulation, which includes steroids, metformin, gonadotropins, clomiphene, letrozole, estrogens, and progestins.
The results from the findings of the research were that body mass index BMI decreased significantly in CAET training, and the mean waist circumference decreased in both CAET and HIIT training. Also, the mean LDL was significantly reduced for HIIT training compared to the women that went through CAET. And also, both exercise regimens were effective at improving anthropometric and some cardiometabolic health markers. However, further studies need to determine optimal and acceptable exercise prescriptions for this population. So, both forms of exercise regimens were effective at improving anthropometrics, insulin resistance, and lipids in women with PCOS. But research findings indicate that there may be differential effects of exercise based on the type of exercise that is done. So, in conclusion, larger studies need to be done to evaluate the impacts of these two exercise regimens on reproductive, anthropometric, and cardiometabolic outcomes. and also to explore the association of PCOS phenotype and BMI to the exercise response in order for us as healthcare providers to inform our patients using clinical practice guidelines in managing PCOS.
So, pros and cons of research. Some of the advantages of this research were one, this would be the first randomized trial to compare effects of HIIT and CAET exercises on reproductive outcomes. Second, they did a 3-month run in phase to determine reproductive function, including ovulation and menstrual cycle length in women with PCOS. And third, this study included both normal weight women and women with elevated BMI, compared to previous studies where they only included women with elevated BMI, which makes this study more generalized. Some of the disadvantage were the study did not have any questionable assumptions. Second, the pilot study sample size was inadequate. There were only 36 randomized participants, so there were only 12 per group, which was inadequate to evaluate efficacy of HIT and CAET. Third, participants may have changed their diet during the study, which could possibly influence the results. Credibility of this study included previous research which were performed and included in the citations, and inclusion and exclusion criteria were discussed in the article.
Applicability in primary care. So, PCOS and its management is applicable in primary care because as clinicians, we need to be able to manage PCOS in our patients. And some of the issues that these patients might come to us with are weight gain, infertility, maybe they're having depression because of weight gain. So, we need to be able to educate them so we can inform them about exercise regimens, diets to follow, also just reassure and educate them regarding menstrual cycle irregularities and when these women are of reproductive age and possibly planning starting a family, becoming pregnant. So, informing them regarding fertility plans or possibly even referring them to a fertility specialist and also improving their quality of life. So, if somebody is gaining weight from it, they might have body image and self esteem issues. So, that can also come hand in hand with depression and anxiety. So, we need to be able to manage PCOS and educate our patients about lifestyle modifications in order to better manage this diagnosis.
And that concludes our presentation. These are our references. Thank you.